video is part 1 in a 4-part series on soft tissue-based shoulder injuries, focusing specifically on clinical presentations and functional-based testing. What's up, everybody? For those of you that don't know me, my name is Dr. Matt Maggio. I am the creator of the Peak Method and founder of the Soft Tissue Revolution, where we teach manual therapists a new treatment system that focuses on working smarter, not harder, allowing them to cut their treatment times by 50% so they can stay healthy and help more people get out of pain. It's going to be part 1 in our 4-part shoulder series, as I talked about in the introduction. We're going to be covering a lot in this series. One thing we're going to be covering is just clinical presentations of issues with the shoulder, specifically to the capsule, the infraspinatus, and the subscapularis. I'm also going to show you some detailed functional-based testing to know if these structures are actually causing the problem. Also going to go into some advanced palpation, because if you can't find it, you can't fix it. And lastly, I'm going to show you some functional-based treatment so you can actually go in there and break down that bad tissue, restore range of motion, increase overall functioning, and lead to long-lasting pain relief. I talk about it all the time, about the idea of like the 7 problems in the human body when it comes to a musculoskeletal injury. I've actually made webinars about that as well. I'll link it up top here if you're watching this on YouTube. If you're watching this on LinkedIn or Facebook, I will also put it down below in the comment section. But usually we're going to have 7 problems. It's going to be a bone problem, cartilage problem, disc problem, ligament problem, nerve problem, soft tissue problem, and a tendon problem. In this presentation, I want to focus specifically just on soft tissue, and what I consider soft tissue is 2 structures. It's going to be a muscle, and it's also going to be a ligament. So the first video that I want to share is a detailed clinical presentation of when a ligament is actually having a problem in the shoulder, what to look for, what it presents with, and overall history, so you can know exactly if it's causing a problem. So I'm going to link that video up first.
Ligaments in the shoulder, definitely symptom location. Like I said, there's problems with the ligament. There's going to be some part on the back part here, definitely some parts in the front in there as well. And people will usually describe that pain as like a tight, achy, restricted, just kind of feels stuck. Symptom intensity, usually what I find is that it like stays in that like 3, 4, 5, 6 out of 10 range. Usually gets a little worse when they go and use it. It's better with rest. History of trauma in there as well. Like I said, if those AC joints and SC joint have been stretched out with trauma, that can cause some problems in there too. And lastly, just their activity and job. Are they like a manual laborer? Are they doing like a lot of overhead workouts and things like that? That really helps you get a better idea. But ligament is definitely a big pain generator in shoulder dysfunction.
This video, I'm going to cover what the clinical presentation looks like in a muscle problem. Specifically in the shoulder, I'm looking at the infraspinatus, supraspinatus, and also the subscap. So I'm going to link that video up now as well, really diving into what the clinical presentations look like.
Tissue, my favorite thing. Soft tissue components, there's different types of things that you get in there. You can get scar tissue buildup. Basically, scar tissue buildup is like glue that gets inside the muscle, makes the muscle weaker, less flexible. You can also get some atrophy where one muscle kind of shuts down, doesn't do what it's supposed to do. You can also see some hypertrophy where one muscle might be working harder than the other. But at the end of the day, those are all soft tissue components. So key here is like, hey, where do you feel the pain? What does the pain feel like? That severity, like it's going to be very similar to the ligament, where that like 3, 4, 5, 6, 7, worse when they're actually using it, better when they sit down. If there has been a history of trauma in there, scar tissue forms over time and really starts to build up. Just a lot of like activities and jobs. I see this a lot with people that have a very sedentary posture, or also people that are like using a lot of their muscles over time. You see this a lot in like blue collar workers and things like this. I tend to see a lot of these problems in specifically the muscles of the rotator cuff, a lot in infraspinatus, a lot in teres minor, and definitely a lot in the subscap as well. They build up and really start to build up over time, and over time that muscle gets weaker and less flexible. So soft tissue is a big component in pain injuries, and it's also the most common problem of that, but also the most reversible with the right type of treatment, proper depth, proper tension, which we teach in the Peak Method training.
A couple of take homes from those videos. The first one is just collecting data and taking a very thorough and detailed, accurate history. So many manual therapists just want to jump right into treatment and kind of see what happens, and they get stuck kind of winging it. And I really want to be able to figure out and collect data so I know exactly what the problem is. I want to learn to start to think critically and figure problems out, and mostly is just slow down. Don't be in such a rush to get in there and do a bunch of treatment. Instead, do the right treatment because you found exactly what that problem is. Now we're aware of potential soft tissue problems, specifically ligaments and muscles. What I want to show next is a very detailed functional evaluation, really getting an idea of what this shoulder motion can look like and breaking that down and knowing exactly how to interpret the symptoms based on the history so you know exactly where to go and how to fix it. So the next video I want to link up is a functional based test that I use for shoulder pain and dysfunction.
This is the shoulder functional test. We're going to get an idea of how the rotator cuff itself is working and how the joint is as well. So for this one, I always start by demonstrating to the client. I say, what I'm going to do is I'm going to see how your shoulders are functioning, and I'll turn around so they can see that. So I'm going to have you turn around, and you're going to do this test just like this. I'm going to have you face, and you're going to go and bring your arms up nice and easy about 3 times. What we're trying to do is see how easily your biceps can touch your ears. On that 4th one, you're just going to hold it at the top. So they've been coached in that. Now we want to actually see them do it. So they're going to do it a few times. And you'll just watch and see if they get an idea of what's going on, get a general idea of the overall motion and how things are going. Good. And then the last one, they're going to hold it at the top. Good. Now relax for me. Now sometimes I want to show you a couple cheats that clients will do. So one thing that they will do is they will drop their head forward. And that is a thing that you want to correct. Another thing that they will do is they'll recruit their whole body and try to really jam and work really hard at that. Another thing that we want to do when we look at that is a couple things. Is they will also pitch their arms forward. So come over here to the side. And what we'll do is we'll look from the side. We don't want to be able to see their ear, because a lot of times what they're going to do is cheat that motion because they're trying to work around that. So you want to look at a couple things. You can relax for me. So you want to look at a couple things when you're doing this. You want to see first that their biceps are going up nice and easy. Secondly, that you cannot see their ear from their side. If they do, you have to correct them. You'll say, hey, your arms are too far forward. I actually need you to come back here, because this is a functional evaluation. It is not a competition. A lot of people want to be like, I can do it, but it's not clean in there. So we've instructed them, and now we know where that goes. So they're going to do a clean test in here, and go ahead. And then they did their reps. And then you're going to ask the normal questions that you always ask. Where do you feel the pain? What does the pain feel like? How intense is that? Then you're going to snap a picture of this so that they can see that in there. So this one is a pretty clean test. You can see how both sides of the bicep are touching the ear, going up nice and easy. I like to see that. If we look from the side, we can see barely any of the ear. That one is really clean. Now when it's bad, show us what a bad test will look like. Sometimes it'll be this, sometimes it'll be this. And other times they can actually just not be able to do the motion as well. So what you're finding in this test is you're trying to see how easily they can go up and touch. And once you get that last test in there, you want to snap that picture, and you'll be able to put it with the side-by-side pictures to show the client that they are restricted in that area. And a lot of times when this is restricted, you're going to find dysfunction in the rotator cuff, the infraspinatus, the capsule, the subscap. You could even find some of that degeneration in there in the labrum with some clicking and some popping. And it can actually, if there's a neck problem in there as well, people will get some pain in through here as well. And you'll pick those questions up on your history. But the key is just to look at the test, make sure everything looks clean. And if it's not, take the picture, put it side by side, and then get in there and fix the dysfunction that you find. And these are some of the cheats that you're going to see. First is their head will go forward. Good. The other one you'll see is that their arms will just go forward in through there. And then the other one that you'll see is they'll use their body and their legs to really go up through there. So you want to make sure you identify those cheats, because if those cheats are there, it's not going to give you real data about what's going on.
Take homes from that functional based video is, once again, just collecting objective data, like getting real data about what's going on. So many times we focus just on the subjective data of like, hey, how does it feel? The symptoms tell us there's a problem, but we also have to have objective data as well to really get a clear picture of what's going on. Then we have some data. We can have some data where we can be at a pre-position and then a post-position treatment, so we can see if treatment's actually working, and we can show that client that they're making progress instead of solely relying just on how they feel, because there's so many other factors involved with that. So in the next part 2 of this training series in soft tissue based injuries, I'm going to be covering the shoulder capsule, specifically the posterior glenohumeral, I'm struggling even saying that, posterior glenohumeral capsule, specifically the palpation of that, and a functional based treatment demonstration using my system called manual scar tissue treatment. So if you like the video, give it a comment, like, or share. If you got any insights, share them in the comments below. Go grab our free training. We really dive into critical thinking, solving problems and the idea of becoming a more of a solutions provider and being a clinician first and then a technician second. If you like all that, then you can take one of our CEU courses. They are available in person and online. All the information is wherever you're consuming this. You can find that in the bio, and hopefully you'll stick around, and we'll see you on the next one. Bye.